Hi, I'm Dr. Sindhu Arjun. I'm a consultant nephrologist and transplant physician based in Goa. Today, I'm going to talk to you a little bit about chronic kidney disease, what it is, how to diagnose it, and how to manage it. So, what is chronic kidney disease? Chronic kidney disease is any abnormality in the kidney's structure or function which persists for more than 3 months and which has an effect on health. So, any abnormality in the kidney structure can be in the form of increased protein in the urine or blood in the urine or abnormality on an ultrasonography of the kidney. It can also include any electrolyte or acid base imbalance. What about any abnormality in the kidney function? It is usually detected by checking your serum creatinine level, through which we calculate something called as estimated GFR or eGFR. If this number is decreased to below 60 ml per minute and this persists for more than 3 months, then we usually say that you have chronic kidney disease. So, uh, how to detect chronic kidney disease? Chronic kidney disease is unfortunately a silent disease. That means that the symptoms appear when it is too late. We are only touching the tip of the iceberg when we detect it in people who have very advanced uh, disease. So in early stages, we have to screen asymptomatic people, that is people without symptoms. So who should be screened for this? Anybody with risk factors such as diabetes, high blood pressure, or obesity, or a family history of kidney disease. When we screen people by checking their creatinine level or doing a urine routine and microscopy or urine protein to creatinine ratio or an ultrasound, then we can detect it at an earlier stage. Um, so, how do we prevent or protect our kidneys? How do we prevent from getting this disease or protect our kidneys? So, everybody can ensure good kidney health by following these eight golden rules. Number one, exercise regularly. Number two, eat a healthy diet which is low in salt and avoid red meat. Number three, check and control your diabetes. Number four, check and control your blood pressure. Number five, avoid excessive use of painkillers. Number six, ensure adequate water intake. Number seven, um, make sure that you're screened for kidney disease if you have any of the risk factors mentioned before, such as diabetes, hypertension, or obesity or family history. And lastly, avoid smoking. If you follow these eight golden rules, then you can work towards protecting your kidneys, and you can prevent getting any form of kidney disease. But unfortunately, despite all this, you might be detected to have chronic kidney disease. So, what do you do if you're detected? So, there are five stages of CKD. There's a stage one, two, three, four, five. Stage one and two are mild. Stage three and four are more severe, and stage five is called kidney failure. So, depending on your creatinine level and your eGFR, you're classified into these different stages. So, consult your doctor if you are diagnosed to have CKD. Your doctor, depending on your stage, might refer you to a nephrologist who's a specialist dealing with kidney diseases, and you will have to follow the instructions. In stage one and two, we work on controlling risk factors such as diabetes, high blood pressure, and avoiding painkillers, ensuring adequate water intake, and reducing salt intake, etc. In stage 3 and 4, we focus a little more than managing the complications of kidney disease. These can be in the form of low hemoglobin level, that is anemia, or low calcium level, increased phosphorus level, which can affect your bones adversely, and preparing you for the next stage. By the time you reach stage 5, your disease is pretty advanced, and your doctor and your nephrologist will be discussing further options with you. Further treatment options include um, Renal replacement therapy. Renal replacement therapy is in the form of dialysis or kidney transplant. Dialysis for renal replacement therapy is life saving and often uh, the first measure that is used. Dialysis is a replacement of your kidney function by using machinery. So there are two forms. One is known as hemodialysis, which is usually done in center, that is in the hospital or in a dialysis unit, and something called as peritoneal dialysis, which can be done at home. So you will have to discuss with your nephrologist as to what option works best for you. Kidney transplant has been, in the past several years, the best treatment available for kidney failure. Kidney transplant basically it comprises of transplanting someone else's kidney into your body. This can be in two forms. One is known as living kidney donation. This is done where a relative or a close friend, somebody can donate their kidney to you, one of their kidneys, and this will be transplanted into you. Other option is deceased kidney donation. Deceased kidney donation involves transplanting a kidney of a person who's passed away, who's brain dead, into you if the family gives consent. And both these options provide an excellent result, and most often patients do not require any further dialysis. So kidney transplant is like giving a second life, and hence we always think of that as the best option for uh, kidney failure patients. So discuss with your doctor regarding dialysis options or transplant options if you have kidney failure. And if you don't have kidney failure, but if you wish to donate your organs after your death, then look into options of becoming an organ donor, and that is one of the best gifts that can be given after we pass on. So I hope today I have enlightened you a little bit about what kidney disease is and what we can do to prevent it and what we can do to manage it. I hope I have enlightened you a little bit about kidney disease and how to manage it, and what signs to look for. I hope everybody has a pleasant and safe day. Thank you.